Everyone, what's up? This is Dr. Charlie Johnson, a physical therapist. In this video, I want to share with you the top 5 most common causes of buttock pain. So I'm actually going to share my screen here. I'll turn things around in a moment as I've mapped out all the details of each cause in a flowchart fashion, but I've tried to keep it really simplified for you. Now, of course, look, there are other causes, but these are the most common that I've identified after working with thousands of people worldwide with unresolved back, butt, and sciatica pains. So if you've got a pain in the butt and you're trying to figure out what's going on or where the source of the pain is, then stick around for this entire video as I go through each of these causes one by one. But be sure to check out my DIY diagnostic guide where I reveal my entire diagnostic blueprint and I show you exactly how you can, from the comfort of your own home, figure out the most likely cause of your pain. You can download that by clicking the link above, somewhere up here, and or clicking the link pinned in the comments below. All right, so let's dive into it. All right, so now what we're going to do is we're going to sort of walk through this mind map, if you will, as it relates to the top 5 most common causes of buttock pain. And we're going to work from, I guess, left to right. Hopefully that makes sense with the orientation of the video, but we're going to start from the most upstream area, meaning your back, and then you have, say, hip and other things below it, right? We're going to start up here, and we're just going to work through them step by step. All right, so first thing, the most common cause, without a doubt, in my experience, of a pain in the butt, whether you feel pain here or not, is absolutely, no question, a problem in your back. So again, even if you don't have back pain, the cause of your butt pain might actually be what we call referred from something, a structure, a disc, a joint, a ligament, something else, a muscle in or around your back. So a lot of people think that if they have a pain in their butt or even down their leg, that it is sciatica. It's due to some type of nerve problem. But the truth is that you don't need to have a nerve problem to feel symptoms that go down your leg. Because again, your body can do what we call refer pain to other locations. You might have the problem, the source of the pain might be in your back, but you might feel it in your butt and or your leg. And so there's this really fascinating guy, Buttock. He's a retired anatomist from, I think, Australia, and basically he studied sort of the anatomical causes of spine pain, back pain, neck pain, things like that. And basically, right, the studies essentially show that if you have any pain, or sorry, any problem in the low back, L3, L4, L5, S1, and this is just referring to different segments, right, within the spine, then the majority of these, areas or segments can refer pain to the butt, right? So you can, for example, irritate a structure. In this case, they looked at the ligaments in that area, but you could irritate a disc at the L3 level. You could irritate a joint or a ligament or a muscle or something like that. And you will see that you can absolutely feel pain, not only where it is, like where that specific segment is, but then it can cause pain into the buttock and or, even all the way down the leg. So pretty crazy. Just know that we call that referred pain. And so sometimes people get tricked up because they have pain, maybe only in their butt or in their leg, and they think it's a problem right there, but it could be referred somewhere else. So it can be a little bit tricky. And so you can easily test out moving the back to see if you can reproduce the pain in your butt and or your leg. And you can do that by moving the back in multiple different directions. And pretty much the back or the body can only move in so many different ways. It can go north, east, south, and west, and then you can sort of go these in-betweens, right? So what I would do is I would do each of these one by one. So I would be seated, palming the floor, right? And then I would be going over, oops, I missed the part of the chair that I'm floating. I would be going over top of my left knee. I'd be going over top of my right knee. Then I would stand, right? And I would kind of feet shoulder width apart. I would tilt my trunk to the right, kink down on that left side. I would tilt it to the right, kink down on the right side. I would then bend straight backwards. And then what I would do is I'd kind of go in these southeast and southwest directions. So I would, if you want to go back to the left, I would twist my trunk to the left and then bend straight back. See what that does. And then twist my trunk to the right and bend straight back. And so by going through these, 8 different directions, you can start to determine, hey, does moving my back have any impact on the symptoms I feel in my butt? And if the answer is yes, Charlie, I can kink to that side or I can bend back and extend. That's actually the most common one that can reproduce the problem, bending back combined with that rotation extension. Then chances are very high that your back, almost without a doubt, is actually the source of your buttock pain. And that's just where your pain is referring to. Now, notice here, I don't distinguish between, well, what in my back, Charlie? Is it my disc? Is it my joint, facet joint? Is it the SI joint, which you could argue is maybe not in the back, but it's pretty darn close to it? Is it a muscle? Is it a ligament? Is it something else, right? I don't distinguish that because it's really difficult to tell. That being said, that's not really the purpose of the video. Just know that if you can move your back and switch on your symptoms, you can get and or reproduce pain in your buttock. And that means that it's coming from your back. It's not actually a problem in your butt. Hopefully it makes sense. Now, that being said, there is an exception to sort of what I just said, right? So whether it be a disc, a joint, a muscle, a ligament, notice I didn't mention nerve, because if you have a nerve problem, then there's something distinctly different from, a structure such as your disc or your joint or something non-nerve related in your back and where that causes symptoms, and the way that a nerve problem presents. So let's talk about that. So it could be a problem in your back. It could also be, and or just independently be, a problem with your sciatic nerve, with your nervous system in that area. So the sciatic nerve is the largest nerve in the body. There's sort of many branches that come out from the segments in the spine, and then they join in your buttock and they go down your leg. So you can see the same article here. Again, Nikolai Bogduck, really cool guy. He says, they did this study, all right, really fascinating study where they did back surgery and they actually placed sutures around the nerves at different segments, all right? And they left these strings outside of the person's skin. I don't know when this was done or how this was done ethically, but basically they were able to pull on them, okay? And so what happened is when the nerve was already aggravated, by the way, the most common cause of sciatic or nerve irritation in the spine is a disc problem. It doesn't mean other things couldn't cause it. It just means that the disc material chemically irritates the nerve. And then the next day, say after these surgeries or whenever, right, if you tug on that nerve, you stretch that nerve, you get sensitivity. So they wanted to see, hey, when we pull on these nerves and we don't stimulate the disc, we don't stimulate other things, what does that sensation feel like, right? And what they found is absolutely it causes a pain in the butt, but it's a little bit more distinct than the other type of pain from the spine, all right? So if you have a problem in the back, the symptoms are generally very dull and achy, and you can tell the mapping of where people experience pain is sort of broad and not very pinpoint or localized, right? But when you have a nerve problem due to either something in the back or something else, right, it is very what they call lancinating, meaning probably like electrical, sharp, acute, and it sort of flows within a 2 to 3 inch gap, if you will, and it goes right down the leg, often below the level of the knee into the foot. So it's a very narrow band versus, again, if we look over here, where are we? It's a very broad sort of swath of area or real estate in the leg or the butt that the pain distribution covers. So how does that help you? Well, if you have a nerve problem or your sciatic nerve is sensitive and you do this test, we call it a straight leg raise test. It's a very good sort of screening tool to determine, do you have sensitivity to the nervous system or not? Under normal circumstances, me, for example, who has no nerve problem or no pain in the butt or anything, right? I can stretch my nerves and compress my nerves and things like that. And I can kind of stimulate these things mechanically by moving my body in certain ways. And, maybe I'll notice some sensations, but they're very temporary and they go away, right? So under normal conditions, stimulating or pulling on a nerve doesn't really cause a problem. But if you have some type of, remember I said the most common cause of sciatica is due to a disc problem. So you can irritate the nerve. Once the nerve is irritated and you pull on it, right, then you can reproduce these symptoms. So if you do this straight leg raise test and there is no problem doing it, and you're like, hey, woohoo, I can stretch this nerve all day and it does not reproduce my leg pain, numbness, tingling, then the chance that you have sciatica goes way down. So if this test is negative, does not cause a problem, you're perfectly fine stretching your nerve on that painful side, then the chance you have sciatica goes way down. And this is useful because somebody who has a problem in the back due to a disc problem, a joint problem, ligament problem, a muscle problem, some other structure other than the nerve will not have problems with this test because there's no sensitivity to the nervous system in this case of referred pain. If your pain is due to a nerve problem, we don't call that referred pain. We call that radicular pain, probably because it feels ridiculous, right? Very painful, very sharp and shooting in a very narrow band. And when you stretch that nerve, if you have a nerve problem, It will absolutely cause problems, at least in the majority of cases. All right. So that is the second most common cause of a pain in the butt is sciatic nerve problems. So sciatica. The third most common cause of a pain in your butt could be a problem in your hip. And you might be saying, Charlie, my hip's on the other side, like my hip's here in the front, not in the back. I get it, right? But if we look at some of the data and we look at some of the research that we've done, right? You can see here, I've kind of drawn out what I call like a pain body diagram. And you can see in the red, these are actually the most common sort of locations of where people feel pain due to a hip joint problem. So most people, 84% of people in this study at least, right, reported some form of groin pain. All right, so that's the most common location. But then also a lot of people felt pain directly in the butt. So buttock pain is a very common referred site of pain with or without groin pain. So if you have a pain in the butt, it may be due to a hip joint problem. If you have no problem, it's not the back and you move the back in all the different directions. If it doesn't seem like the nerve because you can kick your leg up, no problem, then could it be the hip? Well, there's some easy ways we can tell. Number one, location, not that helpful because obviously this video is about people who have a pain in the butt. So you're already here, but maybe you also have pain in the groin, or maybe you have what we call a C sign. And a C sign is if you take your hand like this and you put it around your hip, right? Oftentimes you will get pain that kind of radiates from the front of the hip to the buttock, sort of around the hip joint area. You can see other common areas where people with hip joint problems also experience symptoms would be in the knee or the thigh, and even down to the shin, or I've even seen people say, hey, it feels like there's a tight band around my ankle. All right. And so there are some simple tests that you can do. Again, if you've gone through and you've moved the back in all these different directions, you're like, check, 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 no problem, right? And you've done this and you don't really have an issue. You sat there, you straighten your knee and you pulled your toes up and you stretch the nerve and you don't have an issue, right? And chances are it's not your back. Chances are it's not your sciatic nerve, but maybe it's your hip, right? So some things you can do is you can rotate, kind of like chicken wing in it, if you will. You can rotate that leg out. So you're kind of spinning that hip outwards. And you want to ask yourself, does that cause any type of pain in my buttock and or in my groin or in my hip area? The next thing you can do is this test right here, kind of that figure 4 test, right? So go ahead and try to put that ankle up as if you're trying to put on your shoes. Lots of people with hip joint problems say, I just can't put on my shoes, man, because I can't get my leg into that position. Why? Because the hip joint has become stiff in the case of, say, an arthritic hip, right? And you'll often see painful and limited motion in this test. And finally, bending over and or pulling your knee all up to your chest, you'll often get a pinchy sensation, if you will, or a painful sensation in your butt, if that's where it chooses to refer to, and or in your groin. All right, so these are some easy movement tests, along with where you feel pain, and also along with having the absence of pain moving your spine, and having symptoms inconsistent with sciatic nerve irritation. Then you start to say, hey, maybe it's my hip joint causing the problem. The fourth most common cause of pain in the butt could be a piriformis issue or a problem deep in the glute. You know, some people rename Piriformis Syndrome as deep gluteal syndrome because we recognize that sometimes it's very hard to be specific about, is it your piriformis or is it this other muscle very intimately, close or connected to it. So you can see there, a piriformis muscle is a big muscle right in the center of the buttock. When I say big, obviously it's much smaller than the glutes, but it's bigger than most of the other muscles that help rotate the hip. And the sciatic nerve is very close to it. So you may have pain and tingling going down the leg, but if moving your back did not cause it, probably not the back. If straightening your leg, right, did not cause it, you have no pain and tingling going down the leg, you probably don't have a nerve issue. Sciatic nerve is check, okay. If moving your hip joint around didn't seem to cause a problem, and you don't have pain in the groin, that C sign and other things, probably not the hip. But if you get in this figure 4 position and you pull your knee to the opposite shoulder, then what are you doing? You're stretching that muscle in the buttock. And basically, if you have a muscular problem, which these last two, number 4, piriformis problem, if you will, as well as the fifth one we'll talk about in a moment, muscular problems, then basically the rule is very simple. A muscular problem is going to rear its ugly head and or prove to be painful when you either stretch it or when you contract it, when you use it, because it's a muscle. So it can be pulled on and stretched, right? Ow. Or it can be utilized and contracted, and you'll also say ow, right? So if you have a muscle in your buttock and you take it and you pull it over, let's just say the piriformis muscle or some muscle deep in the glute area, right, and that causes a problem, then it starts to point to something maybe in the buttock. And it could be piriformis, or it could just be something deep within the glute. If you contract some of those muscles in the buttock, in this case, laying on your side, hiking your hip up, kind of raising that leg up, and that's painful, then you start to say, my back was fine, my nerve was fine, my hip seems fine, but could it be a problem with my Piriformis Syndrome, or with some other muscle deep in the buttock region? And the fifth and final cause of buttock pain is your hamstring. So there's something called a high hamstring tendinopathy. Basically what happens is, unlike some of these other causes, which cause pain generally in like the center of the buttock, high hamstring problems cause pain right kind of in the cleft, if you will, like right under your butt cheek, all right? Right on that sit bone as well. So there's a bone that you sit on, you stick your hand underneath your cheek, you can kind of feel that bony area, right? This is the attachment of the hamstring, and you'll feel pain there right at the site of attachment, as well as it might radiate into the thigh a little bit, as you can see here, right on what we call the sits bone. And again, because your hamstring is a muscle, just like your piriformis and or the other things deep in the glute are muscular, if you stretch it or you contract it, then it should reproduce your pain if it's a problem, or if there's something sensitive about that specific muscle, right? So we can kind of do both with this test right here. So I'd say, hey, hold on if you want. If you feel like you're off balance, then that's fine. But take maybe the good leg and see how it feels, and then stand on the leg where you have the pain in the butt. Hold on and do this little, what we call diver. Kind of reach on out, or just let your legs hang, but you're putting all that weight through that leg. And you're kind of stretching it and contracting it. And oftentimes people say, ow, that causes pain right at my butt. And they'll put their hand on it and they'll stand up. Or what you can do is you can do what we call a heel dig test, or at least that's what I call it. All right. So what you're going to do is you're going to lay on your back. You're going to put your leg or your hip at 90 degrees, put your heel on some surface, an ottoman, a chair, something like that. Doesn't really matter. And you're going to dig your heel into that surface as if you're trying to crush it. And what does this do? Well, the action of the hamstrings is to kind of bend the knee, at least one of them. And so what you'll see is that as you do it, you contract the hamstrings and it'll pull on that sits bone attachment. Because remember, tendons transfer energy or contraction of the muscle through the tendon to the bone. So you will pull or stress that tendon. And if it's a problem, it's going to cause you pain. So dig that heel in, and if it causes pain here, ouch. And it causes pain here, ouch. And piriformis seems fine. Hip seems fine, nerve seems fine, back seems fine, then chances are very high that it's a problem with your hamstrings, which is a muscular problem. All right, so the top 5 causes real quick of buttock pain, the most common ones, at least that I see, is going to be your back. You can easily move the back, right, to see if you can reproduce or switch on your buttock pain. Also know that there are many structures in the back which could cause referred pain from the back to the buttock, even if you have no back pain. The second cause, right, it could be a problem with your sciatic nerve. The nerve is sort of a very special tissue, and that it's highly sensitive, and it presents differently than discs and joints and other tissues in the back, and that it causes very narrow bandwidth, sharp, radiating, shooting pain. We call this radicular pain. It's very easy to tell if you have sensitivity of your nervous system, because we can stretch it. And if you have trouble stretching, right, that nerve, and it reproduces your symptoms, then chances are very high, right, that you have some type of sciatic nerve irritation. The third most common cause would be something within your hip, right? And how can you tell that? Well, not only do you maybe have a pain in the butt, but you might have pain in the groin, or you might have some pain that radiates, in these other areas. But, when you single out the hip and you wiggle it this way, or you rotate it in, this is called actually inward rotation. It looks like you're going out, but it's called inward rotation. Or when you wiggle it out, or when you pull it to your chest, right, it might be stiff, painful, and pinchy and reproduce your symptoms. And the final two would be muscular. The fourth one being piriformis. You can stretch it, contract it, right? If that's a problem, it causes everything that you've been experiencing, potentially is the issue. And then your hamstring, sort of a naggy little injury that is felt in a slightly different location than the other ones. Instead of feeling central buttock pain, you'll feel pain right on that sits bone, as demonstrated here, right? And again, when you stretch it and or contract it, you will notice that it will reproduce your pain in the butt. All right, so that's a wrap. There you have it. These are the top 5 most common causes of pain in the butt, and hopefully this clears some things up for you and helps you understand what could be going on as well as why you might be hurting. So, after watching this video, I would absolutely love to know sort of your thoughts in the comments below. What do you feel is the cause of your pain? Is it your back? Is it your piriformis? Is it your hamstring? Is it your hip, right? What's going on? Let me know in the comments. Also, if you found this video useful, please be sure to hit the subscribe button and hit the bell for notifications when I post new videos every single week. Until next time, hope you're doing well, stay well, and we will chat soon.